The wait is finally over. Some 20 million babies and toddlers here in the United States are now eligible to be vaccinated against COVID-19. Over the weekend, the CDC director signed off on the plan after an advisory committee voted unanimously in favor of Pfizer and Moderna's vaccines for children as young as 6 months. Her endorsement means shots can begin immediately, ending the 2.5-year wait on the part of parents, caregivers of children under the age of 5. Joining us now, physician and fellow at the Brookings Institution, Dr. Kavita Patel. She is an MSNBC medical contributor, a former Obama White House health policy director, and one of our favorites. Dr. Patel, thanks for being with us this morning. So many parents breathing a sigh of relief over this news. How soon will these vaccines be available? Can those shots be placed into those young arms? And is there a difference between them? How should parents choose between Pfizer and Moderna?
Yeah, Jonathan, there are sites up and running where appointments start. Some have started over the weekend, I heard, around the country, but most in general are starting tomorrow. So if people are looking, I suspect there will be pockets of the country where it starts later this week. But for the goal of the administration was that 85% of children will be able to have a vaccine within 5 miles. So that starts this week. In terms of choices, it's great that you have them. There's Moderna and Pfizer. I think when you look at the totality of the data, which I have, they're roughly equivalent. It's just a question of, do you want 2 doses to get to vaccination or 3? And which comfort level do you have with kind of the choices of 2 versus 3? 3 is not better than 2, 2 with Moderna and 3 with Pfizer. It's just a matter of, honestly, Jonathan, what I suspect your pediatrician might have in their office that might come down to that decision making. But I do think that if parents are concerned, have a conversation. Moderna might be a profile depending on your summer activities that you want vaccines sooner after 2.5 years of waiting for some sort of solution.
Yeah, such good news for so many American parents. Dr. Patel, let's take a step back and just look as to the state of the pandemic right now. Certainly, deaths nowhere near as high as they were at other parts during this 2.5 years. A lot of people still getting sick, some really, even if not hospitalized, really knocked down for a week or more by these Omicron variants. Give us a sense as to where things stand, and also if we're seeing any signs of more worrisome variants on the horizon.
No, we are seeing just signs globally that, in general, that the Omicron waves, subsequent waves, have calmed down, especially as we look to the UK and EU. But when I say calm down, it doesn't mean anywhere near where we should, just sit on our laurels. They're still seeing surges in pockets of Asia, and certainly in the United States, as the Northeast and Mid-Atlantic have plateaued and cases are dropping, we're starting to see cases rising. To your point about hospitalizations, Jonathan, what we're really largely reflecting is the fact that we still have a lot of people who are either unvaccinated or have been so far from their vaccines and have not been boosted that are contributing to hospitalizations. That trend will continue, especially as we deal with future surges. So in terms of what's on the horizon, we're all trying to brace for what might come this fall. If I said I knew exactly what would happen, I'd be lying. But I do know that we will see more cases. What variant they might be? Will they be related to the Omicron variant? Will we have our vaccines tailored for that variant in the fall? Are all questions that I think we can answer, hopefully. FDA will meet at the end of the month, and hopefully other researchers around the world meeting in the coming weeks to answer.
Yeah, and the White House certainly warning about the possibility of new variants this fall and winter and pushing for more COVID funding. Dr. Kavita Patel, thank you so much for joining us. We'll talk to you again soon.